Welcome back, everyone. A new study says being just a little overweight can take years off your life. The study in the New England Journal of Medicine followed 1.5 million people for several years. It found healthy white adults who were overweight were 13% more likely to die than those at an ideal weight. Dr. Alan Magaziner is here now to tell us all about this. Okay, this shocked me a little bit. It's a big study, but I just wonder how we define that little bit of weight.
Well, what they said is those who have a BMI, which is body mass index, only between 25 and 30 may be at higher risk of dying prematurely. And this is one of the first studies to look at just a little bit overweight. We've known that those whose BMI is above 30, 35 have been at higher risk of dying prematurely for many years. This is the first study to look at those who are just maybe a little bit overweight.
So we shouldn't be looking at the scale here, like what I weigh X amount of pounds, or?
Well, the BMI is defined by, it's sort of a function of your height and your weight.
Okay.
That's all it is. So it's really not necessarily how much you weigh directly. It's related to your height and your weight. My problem with this kind of a study, however, is it doesn't take into account your percent body fat or your lean muscle mass. Because some people can be, have a big body and very toned and have lots of muscle. But this study, therefore, would not take that into account. It doesn't separate those people from other people who are truly obese.
And there are counter studies out there we have to point out that do say a little bit on the body is okay, a little bit of extra.
Right. I mean, a little bit's probably okay, but as you get towards 28, 29, 30 of the BMI, these are the people where they show a higher risk.
They get to, okay. The other thing I want to talk to you about is HCG. This is the pregnancy hormone, and it's being touted online now in a liquid form. You offer this at the Magaziner Institute for Weight Loss in injection. So explain to me the difference here and how it works.
Well, I've been using the HCG program now for several years in my practice. I have quite a bit of experience. We've had hundreds of patients that went through it now. We have found that the injections work far more superiorly than the drops, which are now available as well. They're not quite the same components, however. There is a very strict diet that one must follow when you're on either the drops or the shots. And there's even some topical issues as far as cosmetics, which you cannot wear when you're on.
Okay, and you don't have to be severely obese. Somebody who may want to lose 20 or 30 pounds who's struggling can do this. They have to eat a lot of food for 2 days, and then you either do the injections or the drops.
That's right, but you should be under medical supervision, especially if you're using the injections. Absolutely.
I mean, I would think so, because it sounds a little scary to me.
It's a low-calorie diet, basically, along with the HCG, which what it does, it stimulates the hypothalamus, which then stimulates the thyroid gland to help you burn more fat more effectively. So we've seen people will lose 10, 20, 30 pounds, sometimes in about 1 to 3 months on this kind of a program. It's been very, very effective.
Well, all of this from the pregnancy hormone. Who knew? All right, Dr. Alan Magaziner, thanks so much for being here. We appreciate it.
Pleasure being here.